patient may experience a bulge, or they may feel a hole on their abdominal wall, even a bulge down in the groin area. Those are signs and symptoms of a hernia. They may be not tender, it may not be painful, or it may be red and painful. It could be either way. So there's numerous different types of hernias. You can have hernias from your groin, hernias from an old incision, hernias from weakening the abdominal wall after pregnancy or after lifting heavy things. Some are at the belly button, some are inside your abdomen. But the ones we'll talk today are mainly in the groin, something called inguinal hernias. There's a couple different types, either direct or indirect. There's also a femoral hernia in that location. All those can be treated minimally invasively through robotic surgery. There's also what's called ventral or incisional hernias or umbilical hernias at the belly button. All those as well can be managed by robotic surgery, and that's something that we do here at Orlando Health. The treatment options for hernia range from least invasive of just careful observation, watching that hernia over time, making sure it does not get stuck in the defect, that it does not get red or painful. More invasive, we would proceed towards operative intervention should the patient have symptoms of constipation, nausea, severe pain, redness, or severe tenderness over the area. That would drive us to operate. The benefits of robotic surgery for the patient are smaller incision size. The patient's defect gets closed, the hernia itself. It gets buttressed with a mesh. Those patients are able to go home the same day rather than being admitted to the hospital. Pain has been shown to be decreased with the robotic method, and then our mesh infection rate is decreased overall as well. Treating a hernia early is better than waiting for it to progress. It's much easier to close a smaller hole. It's much easier to close tissues that are healthier than those tissues get stretched out and don't hold a stitch as well. That's much easier, and it allows us to place a smaller mesh in the patient. Patients should seek our expertise when they have a defect, either a hole that they can feel a rim around, or they feel a bulge in that area. Now, if that bulge becomes stuck, it does not go back in and out, that's a reason to seek medical expertise. Or that bulge becomes stuck and you feel nauseous, you may vomit, you may have constipation. That may suggest that there's a loop of intestine in there that needs to be reduced. And obviously we want to make sure that that intestine does not become threatened. Good news is that here at Orlando Health, we have numerous Da Vinci Xi robots, the latest robotic technology out there. We're able to get you into a provider, get you scheduled for the operating room, get your procedure done, get you home the same day, and get you back to your normal life.